I love this time of year in the garden. The evenings are long and warm and the smell of jasmine and stocks fills the air. It's the perfect place to have a beer and a barbecue at the end of a long week at work. We live in town and have quite a compact garden. My wife's the gardener in our house and she's done a brilliant job making it look fabulous all year round. Lots of my patients are keen gardeners and it's a big part of their lives. If your hip is painful and stiff, just doing simple things in the garden can cause hours of misery afterwards. The commonest complaint is that bending and kneeling are really difficult. Twisting and lifting also aggravate the pain, and it's a real struggle to carry even small amounts of garden waste. I've been asking patients how they manage to look after their gardens after surgery. Most of them find that within a few months they can do pretty much everything that they want to. The thing that most of you worry about is the risk of the hip dislocating. It's not surprising, really. We give you lots of dire warnings about avoiding bending and twisting your hip too far, particularly in the first few weeks after surgery. Walking on wet or uneven ground is hazardous because of the risk of slips, trips and falls. It's a wonder that anybody goes into their garden ever again. So what's the best way to approach this? Here's a few tips. Don't try to do anything in the garden for at least 6 weeks after surgery or until you're independently mobile and confident. Be aware of your surroundings and remove any trip hazards such as roots, stones and things like electrical cables. Some people use kneelers like these. They're excellent because you can use your arms to push you up and avoid putting too much load through your new hip. Use long-handled tools whenever possible. That way you won't have to bend or stoop too far. A helping hand is a great tool for pulling up weeds. Try not to spend too long doing the same thing. It's important to take regular breaks and to have plenty of rest between sessions. Drink plenty of water and don't forget the sunscreen and a hat. The last thing you want is sunburn. What about digging? Well, my advice is not to do this until you are completely recovered and not thinking about your new hip. For most people, this is about 3 to 6 months after surgery. Some people have their surgery done in the autumn or winter, so that they're fully recovered in time for the planting season. Whatever time of the year you have your surgery, hopefully you'll be back in the garden in no time at all, full of the joys of spring. Thanks for watching.